the opportunity to, on behalf of Alchem, to present a new technology in refractive treatment. As we know that with the development of technology, have a tremendous development in many fields of their life. And Alchem is a leader in eye care company. We invest a lot of money and technology to develop a new machine and new technology to bring tremendous benefit for the surgeon and the patient. And with our investment and marketing, we recent years very happy that we already sold many wavefly refractive fluid machine in Vietnam, in Hanoi, in Ho Chi Minh, and Da Nang, and Thanh Nguyen also. So the reason why so many surgeons now believe in our technology, the most important thing that our technology can bring tremendous benefit for patient and doctor and for the hospital also. So the theory behind is what? The first, we come with the wavefly femtosecond 200, and it's different with the almost other femtosecond machine right now. It automatically center the flap. Almost machine we flap the center flap and the center treatment is separate. But with this machine, it center flap the same position with the center of treatment, because treatment we can center in the visual acuity or pupil center, but it can flexible follow this. So in some case of retreatment for hyperopia and astigmatism, when we treatment in area periphery, so it's gonna more precise compared with the other technology. And also with very fast machine, faster than 2.5, 3 times compared with the other machine right now. So we're gonna make more comfortable for patient and the surgeon also, and reduce the risk of loss section in the surgery. And also we have a unique technology canal to decrease the OBL. If OBL stuck in the flap, it's gonna affect the precise and can introduce high order aberration after treatment. And also we have a camera to support the surgeon in the surgery. And with our PI, we do not have vacuum inside the cornea, but in the so it's not depends on the K of the cornea. So instead of too flat or too curved, it do not increase the rate of loss section. And with the machine, we have many function, many kind of treatment. But for the keratoplasty is very precise cut, so it's very good for keratoplasty treatment. As you can see here, the results very good. And with lenses we have now in our hospital, if we upgrade our software, we also can have some kind of treatment. And I have 2 words to say about our wavefly refractive machine is auto fast. You have auto center treatment and auto vacuum when the PI in the right position. And very fast, with only 6 seconds to make a flap compared with the other machine. So how about excimer laser wavefly X500? We always focus on patient, surgeons, and the hospital. What wanna bring the sacrifice for a patient? Not only quality, but quantity, but also quality. So what is different in quality? We can see the factor that affect the quality of this image is coma, or T12 is spherical aberration. And it's a study and research in X500 machine, femto lasers, compared with the other machine. And they figured out that after treatment with X500, the high order aberration increased a little bit compared with the other machine from 0.6 before surgery and increased dramatically to almost 1 after treatment. So very high, it increase the halo aberration. It's going to affect the quality of the image. Even patient can get 20/20, but the quality is going to, patient can face some halo delay after treatment. And this is from the study from FDA. We have seen before treatment, have some patient with moderate or severe glare or halo. But after treatment, no more patient with moderate or with the glare, and just no more severe patient with halo. So the secret behind this is what? Is our technology wavefront optimized? We can compensate for the laser when it go to periphery and can compensate for lost energy. So it's gonna make sure that in the periphery we also have a precise cutting. And the second important thing is that it depends on the size of the laser. With different size right now, with 8 nm is the true laser, but the other machine they modify it to make the speed faster, but it's going to affect the precise of the cutting because like we use bigger size of spoon, and it's going to make the cutting is not precise enough. And what we can bring from the surgeon, we have eye tracker 6 dimensions eye tracker, and also have have online pachymetry in the operating room, and surgeon can know what the depth of the cornea before and after treatment. And we have image to recognize the pupil for compensate for patient when patient lay down and the eye will move and rotation. It's going to affect. It's very good in treatment with astigmatism patient. And we also doctor can proactive to control the procedure when we can see the name of patient and the time. And also we have a slit lamp to surgeon can examination patient inside the operating room. So everything here is make surgeon more confident when do surgery. And the most important thing with the LASIK surgeon is the range of the treatment. With this machine, it's a high good range of treatment up to 12 myopia diopter. It's the highest in the market right now. So the reason why is because it less consume the corneal tissue, just only 13.8 micromet. The reason why the same diopter treatment but have a different corneal consumer is because also depends on the size and the shape of the laser. It's going to make less the waste of the tissue compared with the other machine. And it's special thing, not just only Alcan machine have this technology. They can generate meter from the air. The meter in the laser head can because in laser head already have OC. So when we have meter, so OC going to go out and not create ozone. Because if OC inside the laser head is going to create ozone. Ozone very high OC so it's going to affect the quality of the laser head. And we have a new treatment not only for normal myopia and hyperopia patient. We also have iris recognition for astigmatism patient. We have increased depth of focus for presbyopia patient, and also we have streamlined non-treatment for a patient with not depth enough the cornea. And also we have a laser for topography guided follow the cornea map for irregular cornea. And we also apply the artificial intelligence inside the technology. Right now we have some technology for non-touch treatment, but with our new technology we do not the same depth of cut from the center to periphery, so it not increase the myopia for patient compared with the other technology. With the other technology, they want to cut deeper in the periphery, so increase myopia for patient. So inside treatment, the machine already had to cut deeper to compensate for this one. And with right now, not only in Vietnam but also in the all around the world, they apply a lot of topography guided inside the treatment but have some misunderstanding. If this image not only for cyclotorsion, compensate for eye awareness rotation. It not mean that a cornea topography guided treatment. This one is cornea topography guided treatment. It's different. But if we use cornea for treatment, we have to adjust the C4 and C-tail to make sure, because when we treat for higher aberration, it's going to change the diopter, will increase or decrease some myopia. So we have to adjust this to make sure the after treatment the result is good. And with this technology, that's only Elton got FDA approved for topography guided treatment for version eye. It means that I not have a treatment before. And we also can use for patient have treatment before. It's the case study of patient have laser treatment before, but not center. So patient have facing with haloid glare, especially at the night vision. So after treatment, we can see the post-op, the results very good, and patient already get 1.2 after the first day after treatment. And also can use for patient do LASIK before, but the optical zone very small, so we can open the optical zone in the picture under. So after treatment, patient already very happy with this result. And also we can apply this technology for keratoconus patient. The left picture is the cornea map of the patient with keratoconus. But after treatment, we can see the cornea map is almost normal. We can increase the quality of the image for patient with keratoconus. We combine with cross-linking. We can combine with cross-linking in some cases. That is some surgeon in the all around the world already tried before. And the special thing is artificial intelligence. We already investigate it. We already developed it in 10 years ago, and right now we launch it all around the world. It's a video introduced about this new technology. It's a special technology in the refractive treatment. To do this technology, we need a special diagnostic device. So only this device can examination many factors of the eyes. Not only cornea depth, high order aberration, anterior and posterior cornea, but also axial length. All the things related to the optical, so we can create 3D image of the eyes. So we can develop the 3D image of the eye using AI technology. This is just only this only one device, diagnostic device can examination all part of the almost part of the optical of the eye. From the cornea to anterior chamber and position of the lens, and also laser lamp, and other higher aberration also. And after that, we're going to create the 3D image using AI technology. And it's modify the way the light go inside the cornea and figure out a way to change the doctor to the perfect cornea. And the other light will focus on the retina. And all the treatment will link to MS200, and we will combine link from diagnostic at least 500 MS200. And the difference with the other treatment method is that we use all the things related to the cornea and to create a very good, perfect treatment for the patient. And with East 500, we develop connect with the unique diagnostic machine and AI technology to create innovation technology to bring the benefit for the patient and surgeon and the hospital also. And with our purpose is not only bring the visual acuity for a short time but long time after surgery, and also we always develop the new technology to upgrade software for the hospital. They do not need to pay a lot of money to buy new machine, but they can interact with the new treatment method. And also we have CS, like me, clinical application specialist. We working with the surgeon in the operating room to make sure the surgeon will understand the machine very good and using safety and bring the benefit for patient. Thank you so much for spending your time to listening to my presentation.
Thank you very much for your presentation and for lovely English also. So, we still